warm welcome to Bajaj Allianz General Insurance presents Times Network Living Room Conclave, India Health Mission Series, co-powered by Herbalife. India Health Mission is an initiative aimed at informing, educating and ultimately empowering citizens around safeguarding our most valuable and yet often overlooked asset, our health. A series wherein we do a deep dive with industry movers and shakers from across the country's healthcare ecosystem on the roadmap that lies ahead towards building and becoming a healthier India. Since one's most valuable asset is inarguably their health, in an ideal scenario, every Indian deserves access to affordable, high-quality healthcare. So to kick off the series and to shed more light on what's required to make that vision a reality, we're in conversation with the Managing Director and CEO of Bajaj Allianz General Insurance, Mr.Tapan Singhel. Mr. Singhel, thank you so much for taking the time to speak with us. And for sake of some context setting, sir, broadly speaking, when it comes to healthcare in this country, the biggest bottleneck seems to be accessibility. How does health insurance essentially help level the playing field when it comes to patient outcomes?
Thank you. First and foremost, my honor to be here. Second, if you look at, it's what came first, chicken or no, the egg, it's something like that. If you have enough paying power, the healthcare network will expand.
Of course.
Let me put a case in point. When you had this Prime Minister Health for All below poverty line and a 5 lakh sum insured, you actually started seeing the big chain of hospitals open up their centers in tier 2, tier 3, no? Because suddenly you had people with 5 lakh paying power reach to that level.
Right.
So I think insurance plays that important role. I think it puts in a lot of paying power to the last mile. And when it comes there, then you have network of hospitals, then doctors, medicines, pharma. The entire network gets created. If you look at the newspaper reports now, they're talking of so many doctors required, so many healthcare specialists required.
Absolutely.
Government opening up more colleges. So the acceleration is already happening. But the trigger starts from the paying power.
Right.
And that paying power comes in with insurance penetration, I think. So it's a virtuous cycle on that perspective.
Well, sir, you've touched on it beautifully, but I want to do a bit of more deep dive. So when we talk affordability, right, I think the biggest pain point is perhaps that opting for healthcare essentially drives families into debt. It forces them to sell off their hard-earned assets and in certain circumstances even pushes them into poverty. How does health insurance, for the uninitiated, help act as an enabler to prevent such a scenario?
So to understand this, go to any hospital. I think most of us would have gone to hospital to visit some relatives, friends. Next time you go to a hospital, stand at the billing counter. Just stand there, do nothing, observe. You'll be amazed to see that people are selling out jewelry to pay, or taking loans to pay, or selling off their houses, flats. It's expensive.
Sure.
Treatment is expensive. And if somebody falls ill in your family, you would go all out to make that difference, no? And you're not worry about what it takes. And that is where the expense and your entire effort to save the person is so much money that 10 crore Indians actually go below poverty line every year.
Right.
In trying to do so. Now imagine a scenario, and again it was that people with insurance, they actually just walk in and they tell the billing counter, I have an insurance, and they actually have a separate billing counter insurance person. They just fill in forms and they get in the best hospital, best doctor for treatment. They don't even worry about it because it's been taken care of. So it's also not a question of going below poverty line, it's also a question of life and death. If you don't have a good cover, you'll avoid going to a good hospital or a good doctor. You'll try and see, because it's going to cost money. And then you may be playing with your life. So health insurance will ensure, one, that you don't have to worry about if things go wrong. Second, you can go to the best hospital, best doctor, get well treated. And that's a question of life and death. And the third scenario you'll see in a hospital is, you'll see an old person come in, his kids have come with him,
Sure.
grown-up kids, and now the hospital asks for money. And the kids are seeing who will pay the money. Right. Now that old person is lying on the bed and thinking, I spent my entire life, I gave up all my pleasures and luxury
Right.
in bringing up these kids. And today when I require money, they're hesitating as to who will pay. Now imagine if he had an insurance or she had an insurance, they would just walk in with dignity, and the kids come, they have a cup of tea. In fact, some insurance covers provide for the cup of tea also. Have a cup of tea and go back. So it's a question of dignity, it's a question of life and death, it's a question of like pushing you back for 20, 30 years. So insurance plays such a vital role. No, I think when you think from that perspective, then you think, why is it that we are not insured? I think that is what it comes to.
You've really touched on the human side of health insurance, and so, that opting for that world-class, top quality health insurance plan can certainly help provide that sense of security such that an individual doesn't live in fear of being financially burdened in an unforeseen circumstance, right? So to what extent does that help shape an individual's psychological frame of mind? So you've talked about this dignified existence. Perhaps share more examples along the same line.
So most of it I talk about is from my personal experience. So if I talk about my health plan, I have a base cover, I have a critical illness cover, I have a top-off cover, I also have an OPD cover. So it looks like I am over-insured. But let me explain.
Please.
Even if let's say I travel a lot, and if I have some kind of pain also coming in, I walk into the hospital. And I know because my OPD is covered, and that also is cashless. No?
Right.
I see the best doctor. And then whatever they refer to me for any diagnostic, I get that done. So imagine if I was not so well covered, and if I didn't have the network of doctors, hospitals provided by my insurance company, then I would actually be in a time hesitating. Aisa kaun dekhte hain na abhi theek ho jata hai, or I can take some kind of some over-the-counter medicine, and maybe it's something serious, and I don't nip it at the bud, and that keeps on becoming larger and larger, and by the time it actually goes out of control, and then I go there. So fundamentally, the point comes in is that if you have this spectrum of cover that I just mentioned about, then you're not even thinking.
Right.
You have an issue, you just call up the call center and say, this is where I want to go. They refer me to a place on the way. I get down, get myself checked up. Luckily India, that was amazing. It takes me just about half an hour, 1 hour. I'm through with all the checks, and it's all cashed. I just walk out and I sit in the car, and I'm again on the journey.
Right.
Now, this is the difference that comes together, by having a good healthcare insurance compared to when you don't have one. It's the way you think, the mindset, the point you set,
Right.
You don't hesitate at all. Not because you can't afford it. It's just because you have these people who know the doctors, the hospitals, the network, the cashless, they fix appointment also. So it's like a friend in need.
And so nothing is more convincing than first-hand experience. So thank you for sharing that with us. And to switch gears for a moment, Mr. Singhel, increasingly we're seeing insurers focus on wellness, right? Walk me through how health, wellness, and health insurance are essentially all interconnected. What's the underlying sort of seamlessness and synergy between the three?
So one thing, if I look at from Bajaj Allianz perspective and as an insurer, one obviously is business when you put things together, but more than that, I think is solving societal worries. I'll give you another example of a product that we have made, and I'll come to the wellness part of it.
Please, sir.
Now, if I look at India, we have a lot of parents who are staying alone in a different city. The child would be working in India either, maybe in a far-off city like Bangalore or in the US, and his or her parents are staying alone.
Right.
If you ask the child, what's your biggest fear? They say, if something goes wrong, what can we do? Well, by the time you react, it's too late. From parents' side, they would not want to disturb the child. So even if they feel uneasy, they're not just going to call up and say, I'm feeling uneasy now. No, they don't want to do so.
Right.
Now that is creating a lot of issues because you're having a lot of deaths, you're having a lot of delayed reach to hospitals, and a lot of anxiety. So we said, let's try and solve this. We already have a network of hospitals across the country, and we already have a network of panel of amazing doctors, with us. Now all we require is an intimation if things are going wrong. So we actually tied up with one of our good friends to get us a product, a wearable device, which monitors all the parameters that you have. Along with that, a fall detection. If somebody suddenly falls, we have a call center now.
Right.
The call goes there, and they pick it up and they call back. If there's no response, they send an ambulance over immediately. Get the person picked up, take them to the best hospital, best doctor, get them treated even before the child comes to know of it.
Phenomenal.
Now that's where, look at wellness also. It's not about just hospitalization. It's about if you are our customer, how do you ensure that you have a healthier, happier life?
Right.
And if things go wrong, we take full care of you. We're trying to see if we can have an end-to-end solutioning, which should be there. And that's what the industry also starts working on, because this is how you start building up solutioning. And as I said, obviously we are in the business insurance, so in the end it's part of business also. But to think differently from societal benefit is what makes a difference between a good insurer and the rest, because then they would think that, and then business is incidental. It happens because you're building it all up. So wellness is a part of ensuring our customers who are there with us, we try to see how can we contribute to their overall well-being, I think.
So thank you for crystallizing that. And you touched upon business. So I want to take the conversation in the direction of corporates. All right, from a corporate's point of view, to what extent does proactively investing in robust healthcare insurance plans, that truly prioritize employee health, employee mental and psychological well-being, how do corporates ultimately reap the benefits of doing so? What does the evidence indicate?
Huge. Let me ask this question. The day you are not feeling very happy, the day you are stressed out, what is your performance compared to a day when you're feeling happy, you're really charged up, on its own, I think.
It's substandard. I'm getting through the day.
Exactly. And when you're charged up, I think you just like are 10x minimum, of what you would be in terms of productivity or contribution or to the thinking or to the organizational, way it is, or to the contribution, or to the impact is multi. Not about if you take on a per person basis and calculate man hours. Those researchers are available. They clearly demonstrate that these many man hours get saved. Sure. But what people don't take is the consequence of the cascading effect of a person who's not happy.
Right.
And the environment.
Right.
And the overall, the way you would look at it. So from a corporate perspective, I think, and a lot of people talk about it, it's about how do you ensure that the person who walks into office, before they walk into the office also, they're supercharged of what they're doing. And they are the fittest and the healthiest and mentally the most happiest person coming in. Now, maybe you can't do everything, but this small part of taking care of their wellness, giving them access. We did it in the COVID time. We gave access to our people for mental health, and I'm not sure what data would be because we don't ask for individual data. But at overall level, we saw a lot of our employees, at least 1/3 employees, reach out to people to speak about. COVID is usually stressful times.
Of course.
Whom will they talk to? So at least they reached out, spoke to counselors, they figured out what has to be done. So just providing that, and when HR gave me those statistics, I felt, okay, this was a good decision we took. Give people access where they can reach out. Give people access if something goes wrong, they can try and figure out what to be done. Give people access that the company stands by you if things go wrong.
Right.
And just putting that together will itself lead to huge productivity gains, if I may use the technical jargon. Yeah. And it will also lead to a very different environment from a perspective of how you run the company. And obviously the results are manifold in that.
Yes, you've made it so incredibly straightforward, sir, and I think you've really spoken the truth there. Our conversation with the Managing Director and CEO of Bajaj Allianz General Insurance, Tapan Singhel, continues on the other side. So don't go anywhere. Welcome back to Bajaj Allianz General Insurance presents Times Network Living Room Conclave India Health Mission Series, co-powered by Herbalife. We're in conversation with the Managing Director and CEO of Bajaj Allianz General Insurance, Mr. Tapan Singhel, as he shares his take on building a healthier India. To switch directions yet again, so there's so many stakeholders in the healthcare ecosystem, right? So how can the public sector and the private sector, namely the government, healthcare service providers such as hospitals, for example, and insurance companies, be it general or health, better work in tandem to provide world-class healthcare facilities and amenities across the board, sir?
That is something very close to me, Pooja, because I think a lot of people, when they look at insurance, they get confused. And insurance, unfortunately, has a bad perception. It's a perception. When you look at data points, they do a great job. If I look at COVID, the entire insurance industry for health claims paid about 40,000 crores, which was about 5 to 6 times the annual profit of the industry.
Right.
And they didn't even go to the government asking for any subsidy. They just did their job. I think. So from that perspective, they do an amazing job. And this, again, I talked to a psychologist friend, why is it so? The human brain is not wired to see risks, which technically means that there's a very good product which adds a lot of value to you.
Yeah.
But you would still go and buy something at the same cost, maybe just a dinner with your friends.
Right.
You would find that more attractive than buying a whole year of protection for yourself. So that is where government plays a very vital role. So government has to look at ensuring that we have widespread insurance for critical stuff, like health is a very, very critical stuff for any country. Look at all countries across the world, the ones which we so-called developed, they would have health for all, no? I think if India has to call itself, and it's already the 5th largest economy, and we say we'll become the 3rd largest economy,
right?
What use will it be if we become the largest economy also and we don't have even the basic requirement of health for all, I think, no?
Absolutely.
Now, one, insurance companies have to do their job of increasing penetration. But the second is that, like what the government did for below poverty line, they came out, and now some governments are talking about health for all for the state citizens. The insurance industry and the government have to see how they work this out together for every citizen of India. Now, let us say if an individual customer at the last mile has a 5 lakh purchasing power, because that is some insurance right now being offered.
Right.
If I am a healthcare provider, I'm a hospital, now for me, it's not a worry about can they afford my treatment or no,
right,
my infrastructure. They can now. So why would I not expand? Because now my business makes sense to go to tier 3 or to the last mile.
Right.
So then I start expanding. Now if I'm expanding, I have to require more doctors, I have to require more pharmacies, then they also expand. The entire ecosystem gets created. There cannot be anything which can move faster in this country than ensuring health for all. It will also lead to about 1.5% of GDP growth, and we're talking of 6 to 7% GDP growth. Just by doing this, it just takes it 1.5% more, statistically, and it provides like, a lot of financial security to the entire Indians. So this is something that we all have to work together.
So that statistic in and of itself is very heartening to hear. And you referenced the developed world a moment ago. So when it comes to incentivizing healthier lifestyles in general, and perhaps particularly if we were to look at policy frameworks, what are best practices that India can embrace from our global counterparts abroad? So
again, if I look at the OPD part of it, I think the preventive, the diagnostic is very critical. If you're able to detect anything early,
right,
you actually can do a very reasonably good job of having a very good lifestyle. It's only in advanced stages when detection happens that things go actually wrong. So a good diagnostic, a good preventive setup, a good healthier lifestyle, right, is what has to be looked into. Now, if you look at our country actually was doing that. Our country has one of the oldest civilizations in the world. Any place which has a very old civilization actually has over thousands of years developed practices, right, for its people, which we tend to ignore at times. I think if you just do the simple thing, put on what our country has been doing for so many years, and have at the last mile physicians who are able to diagnose things much faster for you, and which should be free, available, and not have the hassle of figuring things out and how it goes. Have a good health cover so the physician gets paid well, so he also or she also has interest of being there. You put all that together, you actually have a happier, healthier country, along with being the most powerful financial powerhouse of the world. I think that is what has to be looked into.
Well, we certainly look forward to that, sir. And you've touched upon the last mile, on multiple occasions in the conversation. So I think as a country, we all harbor the vision of providing world-class healthcare and health insurance across urban and rural India alike. Sir, what's it going to take to make that vision a reality and bridge that urban-rural divide when it comes to healthcare and health insurance in general?
So it's already happening. I think the biggest move was the insurance for below poverty line. So I actually saw a lot of influx happening in the last mile in terms of setting up now, a collection center, setting up, small clinics,
sure,
which is already moving now. I think we have to accelerate this process, and I see a lot of election manifesto now covering this part of it.
Right.
So I think the country is on the right path, but just the sensitivity that if we do this fast, we actually not only grow economically, but we have a healthier, happier citizen of the country. It has a much far-reaching consequence than any other initiative you can think about. So this should be our highest priority, if you ask me, in terms of getting it done.
All right. And sir, speaking of priorities, if we're looking to become and build a healthier India, our top 3 priorities in order of importance, in your view?
First, health care for all. I think that should be, there has to be health insurance, be it by insurance companies, be it by state government trusts, as some governments are doing. I'm not worried about that. but every citizen of India should have a health cover. So at the back of the mind, they should not be worried about if things go wrong.
Right.
Second, open up medical colleges like crazy. I think you really require amazing doctors. Today, Indian doctors are very stressed out. You look at COVID times. I've seen them work for 36 hours without sleep. I think that's unfair.
It's inhuman.
Yeah, for the number of population to doctors we are. So we have to open. And if you talk to any kid and you ask them what do you want to be, every second kid I meet, they say they want to be a doctor. No, so there's a willingness. The infrastructure has to be there. If the willingness is there, and we have a demographic dividend, we have a lot of youngsters, they want to be doctors. So why should we deny them the opportunity of being doctors? They want to serve the country. They want to be good doctors. We should create an amazing infrastructure of getting doctors, very, very fast. Doctor, nurses, pharmacists. We have to. That's the second thing we should do.
Sure.
And third thing we should do is the entire process should be hassle-free. On top of it, the data collected at a broad level can actually solve a lot of issues. If I look at the COVID time again, all insurance companies had data about what protocol is working well and what is not working well.
Absolutely.
Okay, but if you look at individually, hospitals struggling to figure out what works, what does not work. If the government had the mechanism of accessing this insurance company's data and running diagnostics on that to figure out, okay, this place seems to be delivering the best results. What are they doing? It's available because the insurance companies are paying claims, so they get all the information coming together.
They do.
So why can't we replicate this across? Why can't we figure out which treatment is working best for cancer, what's working best for heart something, and what is the place which is working well? The data is already available. How do we use the data for the betterment of society and accelerate and save millions of deaths? So if we do just three things, I think we just transform the whole landscape at a hyper speed.
Well, Mr. Singhel, thank you for digging deep and sharing so many anecdotes and takeaways from your personal as well as your professional journey. We wish you and the larger Bajaj Allianz team all the continued success.
Thank you, ma'am. My honor. Thank you very much.
With that, this episode of Bajaj Allianz General Insurance presents Times Network Living Room Conclave India Health Mission series, co-powered by Herbalife, comes to a close. We trust that you found the insights shared of value. Thanks for watching.